Hello, it's really nice to be here, and thank you to Flen Health for asking me to present today. We're going to be doing something a little bit different. We're looking at how we build motivation and resilience to build our leadership skills and compassionate working with each other and growing ourselves. My name's Carol Young, and I'm a tissue viability nurse consultant and a professional nurse advocate. So to start off with, I thought we'd talk about what motivation is and isn't, because a lack of motivation can really affect our progress. We can cause us to procrastinate and doubt our abilities. It can become a cycle of self-doubt and self-criticism. So motivation is the process that initiates, guides, and maintains goal-orientated behaviours. It's our driving force behind our actions, the purpose, our fire in our belly. And it's our self-investment. It's the thing that comes from within ourselves. No one can motivate us. It's our thing, and it's what we need to do. Sometimes we can lose our motivation. We can get burnt out. We can become overwhelmed with our workload. We can be stressed. And we may start developing those negative or limiting self-belief thoughts. And then we might start procrastinating and avoiding progress. And for some people, we just haven't found what motivates us yet. This session might help you to find what motivates you and whether you're feeling motivated at the moment, or if not, what's blocking your motivation. So for me, I think we all have things that energize us and motivate us, but we also have things that stop our motivation. And for me, these are my motivators and blockers. So for me, if I'm being scrutinised over work I've done, being questioned, having my leadership style questioned, or if there's strategic issues that are blocking or hierarchy and processes that are preventing me from moving forward, these all stop me from being motivated and stop me from wanting to move forward. If the team around me are not motivated, I'm going to feel like, why do I want to bother if they're not feeling motivated? And then physically, if I'm exhausted, tired, I'm not feeling great or in pain, or for me, weather. If the weather's miserable, I'm not motivated to do anything. I'm a sunshine person. I need a little bit of sun in my life to make me feel good and motivated. And then my motivators are really those positives, remembering the things that we do well. So improving patient care and outcomes, seeing success and being recognised for it, and being passionate about a project or a job. If it's something that I really want to get my teeth stuck into, that's going to motivate me much more. And then also seeing others succeed. So if I've taught or mentored somebody, seeing them moving forward and passing through their journey and going on to doing something else, that motivates me to do it more. And then that physical thing of feeling well, having physical energy and the sunshine really motivates me. And I think if we have more blockers and motivators, we're less likely to feel resilient and be able to cope with challenges. The more motivators we have around us, the more we want to change things around us and the more resilience we're going to have as well. So resilience is that ability to cope with and recover from setbacks, the ability to manage and our available resources and find ways of managing a situation that we're facing. It's the ability to ask for help when we need it as well, not thinking we can do everything, but knowing that we need others to support us and help us. And resilience is physical, mental, emotional, and social. It covers all of those aspects. A resilient person has survivor or fighter mentality. And I want you to remember that because we're going to talk about my story later and how important that survivor fighter mentality has been to me. Resilient people have effective emotional regulation. Now, that doesn't mean that they're not emotional or they don't lose control or feel unable to cope sometimes. It just means that they understand that these things pass and can be managed. A resilient person feels in control. They have really good problem-solving skills. They have self-compassion. They look after themselves so they can look after others. And they have good support networks around them. And good communication skills are really important so that you can ask for that help, so that you can work on that team building. So before we consider how motivation and resilience supports us or impacts us, we need to think about those things that impact us in work. And in healthcare, leaders often use human factors to understand what's impacting on staff. Human factors incorporate environmental, organisational and job factors alongside individual characteristics, which influence motivation, our behaviour and our resilience. But sometimes even human factors don't specifically include the health and well-being of staff, but often the human factors can be impacting on physical and mental health of the individual or team. And staff well-being is at the root of compassionate leadership. And clinical supervision, which if performed well, can be shown to improve staff morale and improve retention. So those human factors of that job, what's the nature of our work? What's our workload looking like? And are there procedures in place to support us? What's that individual person got? Are they resilient? Have they got the competence and the skills to do the job and the personality and attitude? Can that be supported more? And what's the organisation, the work patterns? What culture is there? What are the resources and communication? And is there good, supportive, compassionate leadership that are going to support through communication and supervision? Is the environment good for working in? Is there personal space, a place to get away from colleagues when you want a bit of quiet space? And is health and well-being being looked after in terms of stress and burnout and the physical and health and mental health being looked after? So today I'm going to share my story. It's a story of two parts. Firstly, how human factors in my previous workplace impacted on my well-being to the point that I lost resilience and motivation. I questioned my own ability to lead my team. I'm going to share what I did to regain my motivation and resilience, and I'll share with you how I rebuilt my team's motivation and resilience through compassionate and transformative leadership. And hopefully that might inspire or trigger something in you to fire you up and support your teams and yourself. And secondly, I'm going to share how a massive life event could have impacted on my resilience and motivation, but those past events and that learning spurred me on to dust myself down and carry on and be the person I am. So this is me. I'm a third generation nurse following in the footsteps of my mother and my grandmother. And I guess their stories inspired and motivated me to become a nurse. The stories they've told and experiences they've had led me to my training. And storytelling can be a powerful tool in motivation. So hopefully my story will go some way in helping to motivate you and inspire you. I qualified in 1991 and worked on a mixed trauma and elective orthopaedic ward, where I got the flavour of tissue viability. I later worked in a private hospital where I was supported to complete my BSc in tissue viability and went on to become a TBN at a large university teaching NHS trust. And I stayed for 20 years. And some people might say, wasn't that a bit boring? But no, the job changed and the organisation changed so much over the time. And I worked my way up to be the lead TBN for the trust, line managing a small team, 2 band 6s and later 2 band 5 secondees. But it wasn't all rosy and shiny. Into 2018, I hit menopause. I became insomniac, depressed. I lost focus and concentration. I was finding it really difficult in meetings to be non-emotional. I would come back to my office and cry for absolutely no reason whatsoever. And I couldn't work out what was going on. And this wasn't helped by having 7 line manager changes in 4 years. And they all have their different priorities, their different thoughts, their different understandings of what we do as specialist nurses. So I was constantly re-explaining, redefining our role, and also protecting my team from the politics and things that were happening above. And by 2020, I didn't realise it at the time, but I was crumbling. I was burning out. Different line managers had come up with different priorities, different things that they wanted doing, and constantly moving the goalposts, constantly re-explaining what we did and trying to help their understanding was putting huge pressure on me. I was feeling unvalued, challenged, and questioned constantly about my leadership and my role. So my personal resilience was crumbling, and that wasn't helping my team. And I wasn't dealing with situations that previously I could have been helping with. Then COVID hit, and my blood pressure was through the roof. My asthma wasn't controlled, and my GP decided I should be shielded. So began several months of working from home, still trying to lead my team, achieve the impossible whilst feeling isolated from the organisation and events, and very much not in the team. I felt like I was failing. I couldn't be there for my team, and I couldn't be the nurse I was supposed to be when the world needed nurses most. My team were struggling because they had no preparation. They'd been highly reliant on me to sort things, solve their problems, and tell them what to do. They'd lost their resilience and dumped their baggage on me on my return. There were so many emails that said, "Oh, can this wait till Carol gets back? I'll have to ask Carol before I can let you know." And they weren't thinking for themselves and trying to solve their own problems and things that they probably could have been able to do. So I had this sudden realization. I'd been a terrible leader because I hadn't helped them to grow. I hadn't helped them to be resilient and be motivated to progress. I hadn't helped them to be independent of me. So this wasn't helping my stress and my burnout. So it was around this time that I was also successful in gaining a Florence Nightingale Foundation Leadership Scholarship. And the Leadership Academy supports you to find leadership programs and find out what kind of leader you are and give you tools and skills to build your leadership. And for the first time in my career, my eyes were opened to a very different style of leadership. And I began to understand the traits of my past and present line managers. I was given the opportunity to find my own style through various leadership programs, and I found my tribe, nurses who were just like me, who were passionate about compassionate leadership and cared for their teams as well as their patients. I'd actually been told at various times that I was too nice, too caring, and got too involved with my team's lives. But actually, I've learned that this is compassionate leadership, and this is important for your staff's well-being and growth. Participating in a women's leadership retreat at the Eden Project was probably the most profound experience of my life. It was a turning point. I knew who I was and I realised I needed to do something different. I learned to know my value and who valued me so that I could be my authentic self. So I understood that far from being too soft and kind as a manager, I was a compassionate leader. And the definition of a compassionate leader is 4 elements. It's attending, being present, and this means giving 100% attention to your team or your colleague at the moment that they need it. So putting aside distractions such as email and making time for someone and really showing that you are giving your time for them. And this goes both ways too. So if you're wanting to receive support and supervision, you need to be free of distractions too. Clear your diary and your head and give yourself 100% to that moment of support. In practice, take time to notice if someone is suffering at work, asking that question, "Are you okay?" and asking it more than once to see if they have any worries or challenges. Then understanding is showing that you understand the other person's situation or feelings by showing that you are listening actively. You can show this through repeating back in your words what somebody has said and what your understanding of what they have said is, and affirming body language, facing the person, showing that you're listening, giving eye contact, and responding when they're speaking. And be curious, ask more questions to dig deeper. What more can you learn about that person's situation? How can you help? And then there's empathizing. And this is about mirroring and feeling others' emotions, but without becoming overwhelmed yourself and taking it all on. But being aware of the continually changing conditions in yourself and others, and being genuine in your feelings of concern and support. And finally, helping. And this is the practical element of compassionate leadership, meaning it means taking action when it's needed and supporting someone to take action for themselves. It also means being prepared to take your own actions and achieve your goals when advice is given. What can you do to be the most helpful to yourself and those around you? These elements ensure that as leaders, we support the core needs of staff. And that kind of goes back a little bit to those human factors, but includes autonomy, that need to have control over your work life and be able to act within your values and have authority, empowerment and influence, be in a just and fair environment with good working conditions and working schedules. Belonging, the need to be connected to your team and be cared for and care of them, feel valued, respected and supported. Working in a good team working environment and culture with good leadership. And then finally, contribution, the need to experience effectiveness in work and deliver valued outcomes. And that means having a balanced workload, having good management and supervision, and having access to education, learning and development. And there are many people that have been leaving the NHS in recent years saying that these core needs have not been met. So we need to make sure that as leaders, we are supporting those core needs, but also that we're looking at the other steps to well-being. And the Chartered Institute of Personnel and Development split these out into 7 steps. That is health, so looking after the physical health and safety and mental health of our staff. Because it's really important that healthcare staff need to be well and safe before they can look after others. Making sure that they've got a good work environment, management and job that fits in with those human factors and core needs. That there are good values and principles within the workplace. That there's supportive leadership, that ethics and dignity, inclusion and diversity are included in that work. That there's a collective and social communication, positive relationships, that teams get on with each other and respect each other. That there's space for personal growth, so that there's support from mentoring, coaching, there's development opportunities available and career progression. People who are stuck in a job that can't progress and not going to be motivated to progress that career. And that there's room for creativity and innovation, that people can share good ideas. That a workplace has good lifestyle choices. So there's abilities for you to have physical activity. You can go for a walk. There's outdoor space. There's healthy eating available in the workplace. And finally, financial well-being, which is not covered in some of those other steps, including the human factors. You know, fair pay and benefits is a huge factor in nursing and healthcare, and we've seen that over the last year or so with the strikes and the campaigns for better pay. But it's those benefits as well. Good retirement planning, having someone to talk to as you near the end of your career, and financial support, but also things like childcare and subsidised travel, subsidised childcare can really help motivate somebody to be in that workplace. An organisation which has the staff well-being aspect at their heart ensures that the company and the organisation is going to be benefited with inclusive culture, better work-life balance, staff morale is going to be better, and engagement. It shouldn't be an add-on or a nice to have. Well-being should be at the centre of the organisational strategies. So what did I do with all this learning? So I had to adopt a new approach with my team. So we started with a reflection, and we had a group supervision session where we reflected on where we'd been. And our background was that we'd had a 50% increase in our workload over the last 5 years or more. There'd been no increase in resources for the team. We'd had multiple senior manager changes. There's been this huge impact of working through COVID. And the upshot was that we had a burned out, fragmented and very fragile team who had lost their individual resilience and their ability to act independently. And they couldn't problem solve. So things were building up. They'd been very reliant on me and seeing me as a parent role. And I hadn't helped because I'd acted as a parent and looked after them and protected them. And I'd taken on a lot of their worries and troubles and tried to solve their problems. So I had become a place to hang baggage, a place to pass troubles and issues and seek answers from. And the result was that they were totally unprepared for the unexpected. So they had little motivation for change. They were fragmented. Some would say dysfunctional. So we needed an action plan. And I needed to do this for me and for them. I needed to protect myself and my well-being. I just couldn't keep doing what I was doing. And they needed to be prepared for me not being there, because following that Florence Nightingale programme, in my head, I knew I was heading for a new path. I needed to stop being their problem solver and be a listener and coach, and give them the skills to project manage, problem solve, and be independent in their thinking. And then I had to be brave enough to tell them that I had a different path that I wanted to follow. So using compassionate and transformative leadership styles, that I learned through the FNF and the professional nurse advocate journey. We implemented clinical supervision and reflective debriefs on a regular basis. I worked with the individual TVNs through one-to-one coaching and mentoring to encourage independent problem solving and thinking. And that was a huge shock to them to start with, because they couldn't understand why I was suddenly asking more questions and not giving them the answers. But they realised over time that they could actually find the answers for themselves through good open questioning. I introduced the team to QI methodology, and they went on to a training course to develop courses and understand what they could do to support projects. And as a result of that, they were each given a small QI project to lead themselves, to build their confidence and their independent thinking further. This resulted in much more independent working. It freed up my time because I wasn't doing everything, and I could focus more on my strategic role while they led those projects. To start with, it wasn't all plain sailing. They would come and ask lots of questions, ask me what to do in different situations. Again, using that open questioning and that problem-solving approach encouraged them to find those solutions for themselves. And before I knew it, they were off and they were running their own projects, and they were seeing the success of those projects, which was boosting their morale and improving their resilience and their motivation. And they were working better as a team because through the group sessions, they were starting to understand each other's characteristics and what each other had its strengths in. And so they were using each other to solve problems as well, and gaining a better understanding of how each other worked and led. But this is also me. Outside of work, I'm a sailor. I'm a qualified skipper alongside my husband, and we've been owning our own boats for many years. I recently qualified as an ocean safety and first aid officer and completed my sea survival certificate. My dream has always been to sail long distance overseas and find a work-life balance. Oops. In April 2022, I left the NHS and I launched myself as an independent tissue viability nurse consultant without really knowing if there would be any work. Would anybody want me? I was going to need a lot of resilience. Through LinkedIn, I was quickly contacted by industry contacts and other NHS leaders requesting support with education, consultancy, with webinars and clinical writing. I was contacted by an old boss who was now chief nurse at another trust, and he wanted support with reviewing and supporting his trust's tissue viability service as they were going through a big trust merger, and the TVNs were not working as a team and wanting support with how they came together in that merger. For me, my motivation was reignited. I felt vindicated in my experience and knowledge that people wanted my services. I had a renewed energy, and I've been immensely proud of the difference I made. Through mentoring and clinical supervision sessions with those other TVNs, I've seen them go on to other things, promotions, higher education, new posts, academic programs, and gaining their own motivation and resilience. Being self-employed has given me the freedom to pick my hours, It allowed me to work around sailing instead of sailing around work. Over the summer of 2022, my husband and I sailed a yacht from Southampton to Gibraltar, exploring the coast of France, Spain, Portugal along the way. And I experienced my first night sailing, which I thought I was going to be terrified, but actually, through resilience, I found it actually quite an amazing experience. And from my well-being perspective, I found the peace and the calm of sailing at night. And being solo on watch shifts really tested resilience at times. In May 2023, we set sail again with the plan to explore the Mediterranean. And the first part of our trip went amazingly. I even managed to work via a satellite Starlink system, so I had really good internet. But as sailors, we've always split our roles jointly as skippers, but with me predominantly taking the health and safety and first aid roles, naturally, because I'm the nurse, I'm the one with the first aid certificates. We naively made the assumption it would be me that would deal with injuries and illness on board. However, it was a hell of a shock when it was me that got sick. So this is me too. On the 28th of June, 2023, a day before we were due to fly home. And after feeling a little bit off for about 48 hours, I thought I'd had a stomach bug or heat stroke. I woke up jaundiced, blown up like a balloon, and with liver functions that most people couldn't survive with. I was taken initially to local hospital, triaged and given initial care, and then transferred by helicopter to the main hospital with a liver unit. It became very clear that I was in acute liver failure and the cause was not known. I'd not had any previous problems. They suspected food poisoning was the root of the cause. My husband had to make a 3-hour road trip down to the main hospital because he hadn't been able to travel with me. I'd arrived alone, terrified, and unable to communicate with the Italian and Sardinian staff. So my resilience was really tested. We had to make a lot of decisions alone and in a foreign country. We were told I needed a liver transplant and I needed it soon. I was repatriated via an ICU-equipped air ambulance back to the UK and straight into ICU. Ironically, into the hospital I'd worked at for 20 years. Within 48 hours of being on the super urgent transplant list, I underwent a 9-hour surgery and received a new liver. The road over the next few months was a hell of a roller coaster, with 2 further admissions to hospital and multiple medication changes to stabilise and stop me rejecting my new organ. My personal resilience could have plummeted, but I think because of the learning from the last 2 years and the support of family, friends, colleagues, my survivor fighting spirit, remember that resilient person, pushed me forward and kept me motivated to recover and get back to who I am. And I was reminded of who I am while I was in hospital. I even managed to do a bit of teaching with student nurses from my bedside. I'm an independent TVN consultant and educator who loves life and loves sailing. I wanted to get back to that. So my experiences, both professional, personal, physical and psychological and emotional, have equipped me with skills to support others in their well-being, to reduce burnout and increase motivation and morale. Before my big life change, I'd qualified as a professional nurse advocate. A key part of this role is facilitating restorative, resilience-based clinical supervision. RCS is a way that allows nurses to reflect, think out loud, and plan their individual future. It was introduced by the CNO for NHS England post-COVID to support nurses to recover and reset with expert support. But it doesn't just have to be for nurses. It can be for anybody should be able to access reflective supervision. And in my current role, that's what we're achieving. We've opened this up to admin staff, finance staff, HR staff, as well as clinicians. Clinical supervision is done in sessions, either as individual or in groups and teams. It can be used to reflect on a particular incident or event, or it can be used to delve into a career path or a development plan. or just have a debrief, a discussion, offload, talk about worries or issues. It's very confidential, so we provide a psychologically safe place to address those emotional needs without any impact on it being shared with anybody else. It provides thinking space, promotes reflection. It relieves that feeling of isolation by giving recognition that you're not alone. It increases confidence and resilience and enables personal and professional development. It helps somebody to develop their clinical competence and knowledge and improves communication between individuals, teams, and organisations, and encourages innovative thinking. Really importantly, clinical supervision is not a managerial thing. It's not HR or formal process. It's not about checking up on someone or finding fault. And I think that word supervision can give that impression sometimes. And it's not about performance management, but equally, it's not an agony aunt service. It's not for somebody just to come and moan and groan or gossip. And it's not freedom to speak up. There are other places for that. This is purely about individual reflection and growth. So very often as supervisors, we use a coaching model to support those discussions, and you can use these yourself. It can be really useful. So things like SWOT analysis, looking at your strengths and your weaknesses, what are your opportunities and options or threats to moving forward. Or my personal favourite is the T-Gray model, where we look at the topic. What do you want to focus on? Is there something specific, an idea or an issue that you want to look at and change or develop? What's your goal? What's your outcome? What do you want to achieve from this discussion or from this plan? Where do you want to be? So to start that, you need to look at your reality. Where are you now? What's going on just now? This is what I did with my team. We looked at where have we come from? What has gone on before? What's our situation? And then looking at options and obstacles. What gets in the way? What prevents you from growing or moving forward? And what can you do? What resources have you got out there? What other people can help you? And then what's your way forward? What will you do to reach your goal? What can you commit to? And what do you need to get there? And these can really help structure both session, but also structure your action plan. And I'm just going to finish with a couple of examples. So this is where we did our team rebuilding. So our goal was for the team to be resilient and be able to function independently. The reality was that burned out, lost resilience as they were unprepared for being left alone, the increased workload and no increase in resources. The opportunities, if we could get this to work, would be improved output, increased confidence and resilience and motivation. The obstacles were resistance to change. For some team members, they were quite happy plodding along and didn't think that they needed to grow or that they wanted to grow. And actually, as a result of this process, that person has gone on to a promotion and leading her own service, which is amazing. They were blinded to the vision of future. So they didn't think that there was any positives. They were so low and so reduced in their resilience that they couldn't see a way forward. But our way forward was that one-to-one clinical supervision, those team reflection sessions, QI training, taking on responsibility for projects to build that independent thinking and problem solving. And then from a personal perspective, using that GROW model again, for me, my goal was to gain a better work-life balance by starting that independent role. My reality was that I'd been burnt out, I'd lost resilience, and I was missing that respect and value that I needed for my core needs to continue in the workplace. My opportunity was to be my own boss, balance my work with life and not life with work, regain my motivation and passion for nursing. My obstacles was the worry of financial security, being self-employed, my guilt over leaving. I'd been there for 20 years. The thought of the team carrying on without me, or even the organisation, what were they going to do? And I got given a lot of guilt by people in the organisation saying, what are we going to do without you? How are we going to cope? How are we going to carry on? And there was a lot of pressure not to leave. My way forward was publicity, letting people know what I was planning, using tools like LinkedIn to promote myself. And that's quite challenging sometimes to big yourself up, gain business and gain reputation, and keep that resilience and build on that resilience to keep going even when there were lower times. So in conclusion, take time for yourself. Ensure you are well and supported to build your motivation and resilience. Look after your well-being. Consider what stops you being motivated. What are your blockers? And work through how you can change or find a way forward from those. Take time to listen to your colleagues and patients and hear what prevents and encourages their motivation, and see if that inspires you to be more motivated as well. Use a systematic approach through a model, if it helps, to support you in your conversations, your action plans, and your thoughts. And consider what affects your resilience and what you can do to be a more resilient person. Thank you very much. Well, good evening, everybody. Thank you so much for listening to my presentation. We've got a little bit of time now for some questions and answers, and it's really great to see there's already some questions on the chat for me. So I'm just going to go through and I'll read out the question and then I'll give the response. So our first question is, how do you manage someone who's resistant to change? And that can be quite a challenge for us as leaders and as anybody in a team if you're going through a change and a member of your team is a bit resistant and doesn't see the value in changing. I think the first thing is to recognise that that's normal. It's a normal part of the change process to feel that worry, anxiety, that denial, and that feeling of not wanting to change, that everything, why can't everything just stay the way it is? So I think it goes back to that compassionate leadership and that first stage of actively listening to that person who's resistant, finding out what their worries, their concerns are, being supportive and being present, and really understanding that this is okay for them to share that resistance and that worry. Encourage them to look at the benefits of the change and the benefits to them personally and to their patients and to their team. Try and get them to see the positives of the change so that they can hopefully use that to come round to the idea a bit more. And then really importantly, revisit that person after a short period, see how they're getting on, how are they managing, have their thoughts changed, and focus on the positive impacts that they've seen. And always just have some respect and appreciation for the fact that everybody's going to feel differently about change. So our next question is, how do you motivate someone who doesn't want to progress? They're happy plodding along in the same role and they don't aspire to a higher role. Again, it's okay. You know, some people do just feel very happy in their place, in their role, or they may have other commitments that stop them from progressing. So, you know, they may have family commitments, they can only work certain hours, or a health issue. So again, it's about recognizing again that it's okay and that there are many reasons why somebody doesn't want to keep pushing forward and keep progressing. And I think appreciation of their value, appreciation for what they're doing and what they bring to the workplace every day. And then maybe thinking about what brings them joy, what brings them satisfaction at work, and working on those things to maybe find small projects, little things that they can support the team with within their role without doing anything big and dramatic and changing career or going for a promotion. There are lots of things that they could do in their role. Question 3 is, how do you become a professional nurse advocate? So a PNA course is an M-level 7 university course, and its funding has been through NHS England and also locally. So you have to apply through the NHS England PNA website and contacting your regional PNA lead, who will let you know whether there's places available and which universities they can support your application to. The course is 10 days over 10 weeks with a lot of self-study and practice, and you have to do a portfolio to evidence your practice of your supervision sessions. And the course is open to anyone who's band 5 and above a registered nurse at the moment. But there are other courses, things like mentoring and coaching, which could be available to anybody else as well. Question 4, how can you practice compassionate leadership without becoming overwhelmed? Excellent question. And I think it's really about looking after yourself. As leaders, it's really important that we look after our well-being so that we can be in a good place to support others. Because if we don't look after ourselves, like when I got burnt out and stressed, I couldn't support my team. I needed to take that step back and look after myself and find ways to look after my well-being and my compassion to myself before that I could look after them, to prevent me being overwhelmed again with all their problems coming on me again. Gosh, lots of questions coming in now. What steps can you take to rebuild resistance in your team after a difficult time? It's very like the resistance to change, just listening, understanding worries and concerns, and then just taking small steps, finding those positives in the workplace, finding what they enjoy doing, and maybe tailoring a project around what they're good at and what they enjoy doing. If there's a particular area of speciality that they'd like to develop more, is supporting that. And just lots of opportunities for one-to-ones, for reflective supervision sessions, to give them that time to reflect and rebuild and make a plan for the future. I quite like the next question. How do you get your manager to be a more compassionate leader? Quite a tricky one if they're not showing a lot of compassion. But I think it's by showing it yourself. You know, killing them with kindness is a good phrase. Is, you know, showing compassion towards your managers shows them the way that they could be too. And some people, you know, managers, we also have to remember, have a lot of other priorities, a lot of pressures from above. A lot of what they're asking you to do or demanding of you is coming because of pressures from them. So it's recognizing and understanding that will help you to understand where they're coming from. Also helpful if you understand the type of leader they are. Are they somebody who's very process driven? Are they somebody who's very reflective? Using this, understanding what they do can help you to then communicate better with them. And I'm not sure you can change them, but work with them much better. How do we get the seniors to listen, to be able to be open to positive changes? So I think making suggestions like having group sessions, group reflective sessions, having team meetings regularly so that you all have a voice, and so that you can share with seniors and leaders what you're seeing is positive and what changes or what ideas you've got. And also having that knowledge about QI methodology. If you know how to do a PDSA cycle, you know, plan, do, study, act, trying something out and trying and see if your leaders would support you just to try an idea and see if it works. And it might be that it doesn't work and they might be right, or it might be that it does work and you can show them how something could be done. How do you motivate bigger teams when everyone is different at different levels, but the end goal is the same for everyone? It's good communication and teamwork and building that team, understanding what people can do, what they're good at. Even, you know, in any kind of hierarchy, you can have a healthcare support worker who has got brilliant artistic skills, who's really good at making posters or patient information leaflets. Building on the skills that somebody's got. Somebody who's very organized will be great at making your dressings cupboards more user-friendly, more lean, more organized. So getting to know your teams, getting to know people will help you to give people good jobs and jobs that they can do and they've got the skills to do. But bigger teams, you know, it's about everybody working together and understanding that there are a lot of differences, but we can use those differences as strengths. Why is it important to focus on both motivation and resilience in leadership? Well, I think I explained this at the beginning. If you haven't got your motivation you're not going to motivate others. If you're not feeling like you want to move on or you want to change something or make things better, your team are not going to want to either. So motivation is hugely important for your progress, but for also your teams. And then resilience, I think, is essential. If we don't have that resilience, we're not going to be able to fight our corner. We're not going to be able to say, look, this isn't working. We need to try something different. And we're going to go home feeling run down, tired, exhausted. So we need to have that resilience in order to be able to hold our own and put our side of things into those conversations. Let me just have a little scroll down, see if we've got anything else. I think that any other questions coming in yet? To wait for them to come up on my screen. Oh, just being asked to bear with. Well, the next lot of the questions are coming in so fast that the Q&A guys can't keep up with you. It's really good. I'm glad I've inspired lots of thoughts and questions and things for you to go away and have a think about. Any other questions that anybody's got that would like to come in? I think we're just waiting for a few minutes just to see if there are any other questions coming in. Lots of lovely comments coming in as well. I can see on the Q&A. Thank you very much. I really appreciate those. I think that we don't have any more questions coming in. So thank you very much for giving up your evenings and listening to me. If you had come up with any ideas or questions at a later date, just drop a message to your Flint Health Rep and they'll get to me. And I'm more than happy to drop your message back and answer anything outside of this webinar as well. But thank you very much for joining me. I hope you have a good rest of the evening. Good night.